Welcome to the Veterinary Rehabilitation Podcast, where we aim to help fellow veterinary rehab therapists increase their knowledge and elevate their practice. I'm Megan Kelly.
And I'm Anae Lloyd. Together, we bring you the latest insights, research, and information in the field of veterinary rehabilitation.
This podcast is brought to you by Onlinepethealth, a leading continuing education membership for veterinary rehabilitation therapists. With Onlinepethealth, you'll have access to a wide range of online resources to help you stay up to date with the latest techniques, advances, and trends in the industry.
Our podcast features in-depth conversations with leading experts in veterinary rehabilitation. They share their own experiences and knowledge to help you improve your practice. Whether you're a seasoned pro or just starting out in the field, our goal is to provide you with the tools and the insights you need to succeed.
So join us as we explore the exciting world of veterinary rehabilitation and help you take your practice to the next level. Hey vet rehabbers, today it's one of my Behind the Vet Rehab Practice episodes, and in these podcasts we dive into the daily life of vet rehab therapists as they share their wins, their losses, and everything in between. This gives us valuable insights and the lessons we wouldn't have had otherwise. Today I'm chatting with Flude, who is based in the UK. She shares the challenges of starting her own mobile clinic. She opens up about the importance of having the right mindset and really being patient with regards to growth and accepting that everyone's journey is unique. So if you have a mobile practice and are thinking of opening one, I have a great resource for you. It's a PDF called Giving Your Mobile Practice Wings, and it has loads of tips and advice about setting your mobile practice up the right way from the start. So you can go to onlinepethealth.com/mobile. A quick word from our sponsors. Nada first developed her courses at the Colorado State University, where she started the Medical Acupuncture for Veterinarian Certificate program in 1998. In so doing, Dr. Robinson developed a science-based platform for veterinary acupuncture, the first of its kind. Today, Curacao Vet offers a comprehensive curriculum in integrative medicine with a rational, evidence-supported foundation. Courses include medical acupuncture, photomedicine, botanical medicine, medical massage, and integrative rehabilitation. You can discover Curacao Vet at curacao.org. All right, over to my chat with Kelly. Hey Kelly, thank you so much for joining me.
Hi Megan, thank you. I'm so excited to be here. Thank you for having me.
Kelly, won't you tell the listeners about yourself and how you got into the field of vet rehab?
So I didn't actually know that a veterinary physiotherapist or actually physio for animals existed at all until I was in college. And I got to the end and I thought, I don't actually know what I'm going to do with my life after this. So I was scrolling through different university courses and I came upon it. I don't have some kind of amazing backstory about how I knew from really young, but I did know that I always wanted to work with animals. I'd always been brought up with animals. And I was getting good grades in college, and I thought, why not aim a little bit higher than what I originally thought I thought about being a dog behaviorist or dog trainer, because I did agility with my own dog. So I thought, oh, that might be a fun thing to pursue. But I thought, why not challenge myself a bit more? Saw it as an opportunity and took it. And then I never looked back.
So there's definitely an animal theme there. So you obviously have an affinity for animals that led you, if you were going to do the dog behavior, you were looking for something that could involve animals, right?
For sure. And I'm so glad that I did, because it feels right.
So tell us about the course that you did. So you were scrolling through it and you saw this course. Where was it? How long was it? Tell us a bit about your studies.
So I did the integrated masters in veterinary physiotherapy at Writtle College. I believe it's now Anglia Writtle, but I think the course is still the same. It was a 4-year course. I ended up studying for 5 years because I took a gap year after COVID. Yeah, that's how I got into it. That's my only qualification for the job.
And so you qualified a year ago. So you've been 1 year in practice. Tell us how that's been.
Wow, that is a really broad question. So I was very lucky, and I had a local lady who was a McTimoney animal therapist offer me to take over full time for her after I finished uni. Funnily enough, she was due only about 2 weeks after I finished uni last May. So I'm very, very grateful for that. And it has definitely shaped my experience and how the last year has gone. So I worked full time for about 6 months until around Christmas. And then she started coming back part-time, slowly taking more and more of her client base back. So I had more of an opportunity to actually start up my own business from around Christmas. But I didn't actually end up having my full-time own business until around the end of April this year. So I've only actually been fully my own boss, if you like, for about 3 months.
So that was super convenient for her. So when you say she was due, so it sounds like she had a baby.
Yes, yeah. She had a
Yeah.
little girl.
Oh, cute. But that must have been a bit nerve-wracking for you to take on somebody's whole business. I mean, what are the roles that did you just have to see the patients, or were you responsible for a lot of the financial things and all the administrative side?
Yeah, so I was absolutely terrified. I was incredibly excited. And I remember the day really well when I got the message come through. It was about November 2022, so about 6, 7 months before I finished uni. And I remember first being really excited and then suddenly being like, oh my gosh, I've got to take over somebody's full-time business. And what if their clients hate me? Or what if I'm really bad? Or what if she expects too much from me and she's always over my shoulder? And none of that happened. It was fine. But I was 100% seeing all of the clients. I was dealing with 99% of the bookings myself, as it was easier, as I was the one seeing them. I knew my availabilities better rather than going through her and then through me. There wasn't really a lot of finance to go through. She had a really good invoicing system with QuickBooks. So she would be paid the full amount, and then at the end of the month, I would invoice her, and then she would pay me the percentage that I was owed. So it actually worked out really smoothly. So I really couldn't have asked for it to have gone better. She was super understanding. She was always very supportive, and I never had any problems.
Yeah,
But I
and I'm
do
sure she's
remember,
super
sorry, go
grateful.
on.
Yeah, I'm
For
sure she was
sure.
super grateful to have you, because when you have a baby, it's like you just need somebody to take over. And sometimes it's not that easy to find somebody who's prepared to do that for a short period of time.
Hmm. I did think about it and I thought, maybe she probably would have liked somebody with more experience, but somebody with more experience has their own client base already. And that was one of the things that thinking about actually calmed me down a lot, because it couldn't have really been any better for her, because I was suddenly able to fully put my all into her business.
Did you ever have any thoughts about the way that she practices and the way that you've studied and you've been taught, and whether that would be different, and whether the clients would be like, "Oh, you're doing that wrong," or "You're doing, not wrong, but sometimes, if you do something different in their mind, well, that's not how whoever did it."
So there was nothing that ever I thought was unusual or weird, because I shadowed her a lot. I tried to make time to come down and see her, see how she did things, and to meet a lot of her clients, because naturally a lot of her clients were quite apprehensive when they heard that she was having someone take over, and then all of their information, all of that kind of personal, what's the word? She knew them really well. She would ask about how their families were getting on and how their dogs, she knew everything about them, like when they had their wedding. And then all of a sudden, all of that personability, I don't know if that's a word, but I think you get what I mean, is
Yeah.
gone. And you just have somebody else that you're entrusting the care of your dog with, who is fresh out of uni. So I was really empathetic to clients' apprehension, and I tried my absolute best to make them feel comfortable.
I'm glad that you shadowed her and you actually spent some time, because then you had an idea of like how she was and what she did.
Mm,
I mean, think that would be my first thought, is like she studied something slightly different, right? So
mm.
she's not exactly the same, but a lot of the things we do are very similar. So I think that would have been my worry.
Yeah, definitely a lot of clients, they were very sweet about it, but you could tell that they were watching you as if to be like, oh, so and so doesn't normally do that. But a lot
Yeah.
of them were very good and asked me, and I was always more than happy to say, I know that this isn't how Claire normally does it, but this is exactly what I'm doing. It will not cause your dog any harm. I'm just looking for the range of motion of so and so just by moving this and this. And I never had anyone go, oh, I'm really not comfortable with what you're doing. And from what I was told from, her name is Claire, as you now know, um,
Yeah.
never had any bad feedback. So I must have done an all right job.
Sounds like you did. So let's fast forward a little bit to when Claire, obviously her maternity leave came to an end. How did you guys work that transition? Did she just come in and start treating some patients? And then were you, how were you paid? Were you paid on a commission basis per patient that you saw, or was it a fixed rate?
It was per patient that I saw. So we would split a certain percentage. For me, of course, I got a little bit more because I was the one doing the main work, but then, of course, she got some as well. It was invoice based. So again, I invoiced her at the end of the month, and then I would just get a lump sum transitioned over.
Okay. And then when she came back, how did you divide up who was doing what?
So it was more a case of, bless her, it was more difficult for her because she was trying really hard to arrange childcare. And I think she got disappointed a few times. So things were quite fluid. There was a lot of things like, oh, could you do today? Or could you do so and so and I'll do so and so. But we tried to kind of do certain clients, which made it easier because it's easier to remember what you did last time with that person rather than going, oh, what did Claire do with you, and have to really reread the notes and ask questions. But we made it work. And to be honest, we never had a time where I felt confused. We were always really good at communicating with each other, and we'd often sit down and discuss a client together, which was so, so good for me as well, being fresh out of uni, because I would go, I saw this. What are your thoughts on that? I feel like it's, for example, neurological based from the evidence I've found. And then she would go, oh yes, I see what you mean, but also maybe it could be from this, blah blah blah, and then we talk about it, and then of course we could give a better treatment to that patient.
Yeah, I mean, that's one of the things that when you first start out and you are on your own, that's one of the things that is so hard, right? Is not to get
Mm.
that colleague feedback, because especially someone who has a different approach. I mean, I think it's amazing when you have a team and you've got somebody who's studied something slightly different, because when you are exposed to them and you listen to the things that they're saying, you learn so much. I mean, that's your area for growth. So
Mm.
it's awesome that you had that opportunity. Was there never a thought from your side or hers that maybe you should actually team up? So to actually join forces?
So there's definitely clients that I have recommended for them because she is McTimoney and I am veterinary physio. She of course does chiropractics, whereas I'm basically massage and electrotherapy based. There's definitely my own clients where I've gone, I really recommend going and seeing her for an odd checkup, just because of course I can't do the chiro, but I've worked on a lot of the soft tissue that's pulled it out of alignment in the first place. I don't There's kind of potential plans in the future, depending on what she does. Perhaps she might start up a bigger clinic. I'm not sure. We've kind of very briefly talked about it, but again, it's really, really early stages. No one knows what's going to happen. Things change in life. Other than that, we actually do a seminar together, which I absolutely love, and it almost made me want to get into lecturing, but I think that's a bridge I will never cross, just for how stressful I imagine it is. But we are actually we did a lecture last year for clients and anyone who was interested on sporting dog injuries, and
Mhm.
we had such good feedback. We're actually doing it again this October. And for anyone listening who is kind of thinking that they're not entirely sure or maybe getting a bit of imposter syndrome, definitely think about doing it, because it is absolutely amazing for kind of you realize how much you actually know when you're telling it to somebody else. And then when you have an engaging client base that's asking you questions, challenging you, and you're giving them feedback and going, oh, actually, I don't know that, but I'm going to go research it. It's so, so rewarding, and gives you so much self-confidence. But I'll talk about that more in the advice section because I've got a list.
So that is something which I always encourage. So I'm super proud of you for just like a year out of uni already going to do talks to pet owners. So I mean, one of the things that is so important for us is to educate the public, right? About all these things that we can help with. And all the things that they can do, because there's a lot of things that we know that they can do to help their pets. So yeah, well done for taking that step, and well done for doing it again, because I know how scary it is. But like you say, is that, you actually only realize how much you know when you start to speak and do these kind of things. And you realize that people are asking you questions and you actually have all the answers. And if by chance they ask you something that you don't know, it wasn't something that you were supposed to know, actually, because it's probably something that's unrelated, but maybe has a slight connection. And like you say, all you say is, that's a really good question. And I'm going to find out more about that and get back to you. And that's fine. Like nobody expects you to know everything about everything, you know? So you literally are out there sharing your knowledge. And I also think it's such a great networking opportunity and relationship building opportunity. So when all the times that I've done lectures and I've had like clients or pet owners there, those have been like my biggest fans, those clients that come to those, you know, and they are the compliant ones. They're the ones that do the things that you say and you get the
Do
results.
their homework.
Yeah, exactly. And it's so rewarding because you have those clients that just like, okay, like I'm going to do this. And it's super, I love the idea that you're connecting with Claire again and doing that together. Because it is a great way to connect. And I mean, there are multiple times that I've actually lectured at conferences where there are like 6 or 7 therapists that are there, or might be vets or vet techs or whoever. And when you lecture together, you build relationships with them. So it's a good thing to organize. Like if you're the organizer of one of these, you end up like really, really like fast checking your networking and making connections with people. So yeah, good on you. I'm super proud of you.
Thank you. And don't get me wrong, like it is terrifying, especially the first time you do it. But as long as you have a good, you take the time to meet the person you're doing it with, understand more about them, go through it together and communicate, you will be just fine. And it is so, so worth it for that bit of fear you feel at the start. So go for it. If you've got the chance, do it.
And if you're doing it with somebody else, it actually makes
Mm.
it feel better because you're not on
Yeah.
your own. So like if there is a question, you could always say like, Claire, you know the answer to that, you know? And
Yeah.
if she doesn't, you'll go, no, no, I don't. And then it'll make you feel even better and not you feel like, oh, well, I didn't know it. And if she does, then you're like, oh, sure. Okay, save that one, you know, she got the answer.
Exactly.
And
It's a
you're doing it.
win-win.
So yeah. Kitty, let's chat about when you made the transition to your own practice. So that must have been like quite a big step. So you're obviously seeing your Claire's patients. How did you get all those new clients? So when you started off, was it a slow transition, or was there a cutoff date where Claire was like, I'm back?
So, because of the same kind of childcare problems, it was meant to actually be around the beginning of March. So, I was kind of putting in the works to prep, putting my name out there a bit more. And then it kind of went to the middle to the end, and then to the middle of April, and then all the way to the end. So, it kind of dragged out. There wasn't a sudden day where it was like planned. It just kind of one week, Claire was like, oh, I'm actually like, I've got childcare sorted now. It's in the works and I don't think I'll be needing you anymore. So it was quite sudden, but
Mm.
I wouldn't say it was a shock because like I said, it had been dragged out for a while and it had been less and less and less to the point where I was maybe seeing only a couple of people a week. But it's been it's not like I suddenly had all these people waiting to break down my door to come. And I think one of the big things is again, it's the imposter syndrome and realizing that making your own business does take a long time and comparing yourself to other people. By all means, keep your fellow classmates, other physiotherapists, professionals in your area really close because having a good relationship with them is vital. And knowing when you might go, oh, so and so's actually had a lot of experience with neurological problems. And even though I'm well equipped and I know everything that textbook wise about this client and how to treat this, I actually think that they would get just that little bit more comprehensive help with this person. That doesn't mean that you're not able to do it and that you're not good enough. That just means that you have the animal's best interest at heart and you're going, this person's had loads more experience with this specific case than me and I want that animal to get the absolute best care they can. And I think that they should see that person or at least network with that person, reach out with them and go, what's your opinion on this? I'd really appreciate it. It doesn't make you any less of a therapist. It just means that you've got the animal's best interest, which is at the end of the day what you should be doing. But it's also very easy to compare yourself when you look at other therapists, whatever your profession is, on social media, to go, oh my gosh, they look like they've got so many clients. And I've only got, I'll be honest with you, I've only got 21 clients right now. I
Mm.
appreciate that I've only been in the works properly for 3 months, but I'm also actually a pet sitter on the side to try and earn some extra money. And I'm currently fully booked up until mid-October with that. So I'm trying to earn money, but also dedicate enough time to actually start up my business. But it is slow burning. And people are very, very good at making their social medias look like they are super successful. Because why wouldn't you? The busier you look, the more people are going to be impressed with you and go, wow, she must be good because everyone wants to see her. When in fact, they've probably got a similar amount of clients as you. They're just really good at social media. So don't get disheartened. And if you're ever worried or think you're doing something wrong, reach out to people, because if they're a nice person, they will want to help you and say, this worked for me, this didn't work for me, maybe try this, etc. So,
It's such great advice, really. Like, I think we often look at other people, and like, I always just remind myself that social media is not real, right? So what's there is like what you see is not actually how it ever is.
yeah.
You get to post whatever you want people to see.
Hmm.
So, but I think, one of the things I loved what you said, and it's actually how I used to practice. Like, we're actually in this for the animals and whatever is in the best interest of the animal. So yeah, if you refer it on to somebody and you think that that's going to be better for them and they're going to get the best outcome that way, then and there will be cases that they'll do the same for you. They'll be like, oh, that Kitty's better at seeing those cases, I'm going to refer. And I had very similar relationships with a therapist near me. And we used to refer back and forth. So I love that mindset of yours. It's really, really great. Tell me, how did you start off in the beginning, and what is your marketing strategy been? So how did you start getting your first clients, and how are you planning on going forward getting new clients?
Wow, that is another really broad question. So I can't give you a foolproof answer because I'm still learning. But what has worked for me so far, and I'll try not to branch too much into my advice section, but I have found that who you know is way more valuable than your social media presence. So if people meet you, they get to know you, they are much more likely to want your service, because seeing somebody over the internet, you have no idea what that person is like. Sure, they might look like they're successful, but you know nothing about them. You don't even know what they look like half the time. So getting any way that you can get yourself out there, and I found this with vets as well. I personally don't find that just dropping flies in has done me any favors. So I have plans in the works to do like a lunch and learn, where I actually go in there and meet them all and say, I'm so and so, these are my credentials, this is what I've done. I want to work with you because I can help with this. Because I feel like that is so much more valuable than just dropping your flies in and they didn't even see you because they're all busy. And I think it's the same with clients. I've tried to get myself out there, attend a lot of agility shows because I've got a lot of networking in there, and actually offer like free checkups, free advice, just being there as well with your branded clothing. So if people go, oh, my dog's actually been limping today, have you got any advice for me? And you can say, well, sure, let's talk about it. Like people meeting you and going, actually, she was a really nice person and she seems really knowledgeable. That did wonders. I'm just trying to think of anything else. I had something and I forgot.
The lecturing
um,
is the lecturing is an awesome one. So I mean, even
mm,
just the lecturing and things that you're doing like that. So those are a really, really great start. And I've actually got a download. I don't know if you've seen it. It's 20 free ways to market your vet rehab practice.
no,
So when we finish chatting, I'll send it your way. And some of the things you've said have actually been in there, but I've got like a whole probably another 14 other ideas for you inside there.
oh,
Ways to
me
market your
too, yeah.
practice. But like one thing that you said earlier is that it does take a while, and so you can't expect it just like I put all this effort marketing and then suddenly it takes off. It is time, and it is building relationships with people that will refer to you, such as vets. And as you treat cases and as you get great responses to those treatments, and they'll start to realize, oh, I can trust this person, you'll start to see more referrals coming in. And how it basically works, if you think about it, if you're going to put your name on the line and you're going to refer one of your clients to somebody else, you have to 100% trust that person. And so that relationship building is where the trust comes in. And before they're prepared to send their clients to you, they have to have the trust. And that takes time. Trust is not something that you can buy. It's not something you can get on social media. As you said, it takes time in building relationships. And the more you lecture and the more you go to things and the more you meet people and they get to know the type of person you are, you can build that trust. One of the ways that, over the years of me interviewing so many different vet rehabbers, one of the things I do know is that the biggest way that vet rehabbers get new clients is through word of mouth. And so when you have 21 clients like you've got now, you will see they'll start to tell people and that will build up. And that momentum also takes time to build up, because when you've got a lot of people first, they'll tell one or two people and then you'll get clients. But once that grows and you have a massive clientele, the swell from that and the reaction from that is so much bigger with word of mouth. So I think you're being patient and you're doing all the right things. What I will say is that you just got to be consistent. So that's one of the things I think what happens is you get a bit despondent, you try a few things, you think they don't work, but because they take time to work, you think, oh, and then a lot of vet rehabbers just give up a little bit and then something will spur them on to do it again. But if you just keep on it and be consistent, it will happen. So if you had to change things or anything in the way that you started now, is there anything that you would do differently? Is there anything that you've done that you think, oh, I wish I hadn't done that, or that didn't work out so well?
Something that I would have done differently is, I don't know if realistically it would have been feasible, but when I was at uni, I wish I'd have taken more pictures with the clients and practicals I did to really kickstart my social media. Because I
Mm.
remember when I first sat there to try and start up and I was doing my website, I was thinking, I don't actually have any pictures to put on here, and that doesn't look very good. And I was like, damn, I really wish I'd have just taken a second to just snap a photo or hand the phone to my friend. But other than that, I can't think of anything, again, because I'm so in the early stages, that I kind of regret doing or not doing. But I have found, again, I wish earlier on I'd have been more proactive with, like, going around with business cards, flyers, dropping into pet shops, dog friendly cafes, going up yards, because I feel like maybe that would have sped up the process a little bit. Um, and like I said about the vets, I wish sooner I'd have gone, you know what, I'm going to do a lunch and learn, rather than just go and pop in and drop off some flyers and chat to a receptionist, because the vets are always busy. So that's probably what I can think of right now.
Don't underestimate the receptionists. So building relationships with them is sometimes even more important than the vet. So the receptionists have a lot of pull when it comes to the clients. They know the clients in another level, usually a lot more friendlier, and sometimes will be the person who actually makes the referral. Or when the vet comes, they'll say, oh, I was thinking maybe Mrs. So-and-so should go and see Kelly, that veterinary physiotherapist. What do you think? So sometimes they're actually your biggest like promoters. So yeah, spend time with the receptionists and make sure that you get to know them and build the relationships with them too. So don't, they what we call the gatekeepers also to the vet. So the vets, and I know because when I was in practice and people came to see us, when we're busy and someone says, oh, somebody would like to come and see you, and you'll be like, oh, who is it? And like, well, what have they got? And like, how long do they need? And, we're like, and we're like, oh, not today. And then what will happen is if the receptionist would be like, oh, this is the second time this person has come and you need to see them. That's it. Like they're here, they're going to sit and wait. And so the receptionists are the ones there that are actually going to get you in. So yeah, don't underestimate building relationships with them. It's not only the vet. I love that advice about the pictures, because if I think about it, like just even when I was in practice, I just wish that I had taken more videos and pictures and saved it in like a video and photo vault, like on a Dropbox folder or a Google folder or whatever, because even when you're doing lectures and things, and sometimes, you know, when you first start out, you're not thinking about what you're going to use all these videos for. But you then get asked like 4 years down the line or 1 year down the line or whatever, like to lecture somewhere, and then you like put your presentation together and you're like, oh, I'm going to say this, I'm going to talk about this client that I had or this patient, and then you look and you've got not one picture, or you don't know where to look for the pictures. So I would 100% recommend, like from the beginning and even at varsity, you know, just start taking pictures of things and put them into folders. And there, another example where you could potentially use these is writing for magazines. And that is a great way, Hetty, for you to promote yourself. And it doesn't even have to be a local magazine. You can ask to write an article for veterinary magazines. So you guys have got loads of vet magazines out there. I think there's the Vet Times and there's one called Vet Practice. Reach out to them, like go Google up to them, go to the editor and reach out and say, I'm a veterinary physiotherapist. I'd love to write an article for you on this, and give them something like what you're going to write. And I promise you 9 times out of 10, they'll say, that'd be awesome, because they are always looking for content. And, you know, for them, it's like trying to reach out. And then what happens is when you get published in these kind of veterinary magazines, your credibility like goes sky high because you've been published, you know. And so the local vet down the road, he gets the magazine and the post, and he's like sitting there and he's like, oh my gosh, like, isn't that the girl that popped in the other day? Wow, like she must be quite something. She just got published in this magazine. And your credibility just goes up and like notches every single time you do that. And it is super easy to get it done. And you can even do it in pet magazines too. I mean, they're always looking for people. So writing articles as something, and then if you've got that vault of photos and, you know, you've got photos then to show them, remembering always that if you're ever taking pictures of patients, that you should always, especially with like privacy and things now, always get permission from the client. And I used to do this actually on my consent form. So there was a box that they had to tick that they are happy for me to publish any photos of them or their dogs. And sometimes they will say, not me, only my dog on there. And on social media or in any print magazine that you write articles for. So you need to put that on your consent form. And some people can be very, very, very funny about it. And we once actually at my practice had a client who'd actually said no. And by mistake, one of my people that worked for me posted a picture of just her dog, and it wasn't even her dog's face, it was her dog's bum basically was in it. Like, it was actually a picture of somebody else, but her dog's bum was in the picture. And she was devastated, literally devastated. She called me, I had to remove the picture. She had a very huge issue about her or her dogs being on social media. Like, it was like I don't understand it, but literally it wasn't like we like took a picture of her and put it on. It was literally she was in the photo. So you never know how people are, and some people are very, very funny about that. So always just like dot your I's and cross your T's with those kind of things.
I think as well, just adding on to that, funnily enough, I was having a chat with a colleague about this yesterday. She's also actually had a podcast. It was Honor. You might remember her from a few months
Yes.
ago.
Yeah.
And we were talking about just how important knowing psychology is for people, because you learn very quickly what kind of signs are a client that you can't trust, or a client that might mess you around, be unreliable, and just not be worth your time, or somebody that is the kind of person that might have your service, tell you they thought you did amazing, and then actually go and tell other people that they didn't think you were that great, or that they think that something you did caused a problem. So learning how to read people as well, it comes with experience, unfortunately, for a lot of people, but it's really important because that will save you a lot of hassle in the future.
People are so different yet the same. So what you say is so true. Like, you just know when a client comes in, you have a few like just a few chats with them, and you're like, okay, I know who you are. You can actually like box your clients into specific types of people and talk to them completely different. But I think you're right. It is one of those things that you just learn over time. But maybe that's a webinar for us, the psychology of all of the different types of clients that we have and how to handle them. So what is one of the things that you have struggled with in this transition from being a student into into having your own practice? I mean, dealing with clients, is that something that has been hard for you? Because I know how some of them can be like, and especially when you're new and you just started. I remember for me, I just wanted to help everyone and I wanted to be everything for everyone. And then you get to a point where you realize, oh, I can't do that anymore. I'm not going to be able to carry on being this person that they want me to be.
I think one of the big realizations that I had when I first finished uni is, of course, it's you go through the whole shock of suddenly having all this free time after studying so hard, and you almost don't know what to do with yourself. And then you get hit in the face by this sudden wave of, oh my gosh, I have to be a responsible adult. And then as you start actually trying to build up your business, you realize just how little you are prepared. And this is in absolutely no way a bash at my uni or anything like that. I think it's very general that you get like your business studies, your professional skills, where they talk about like make a business plan and do this and do that. But when you actually get put into the real world, especially because everybody's circumstance is so different, it's impossible to teach you all of the different obstacles you might face and how it's going to be. And I do wish that there was a little bit more of an emphasis of don't put too much pressure on yourself, and you are not going to have a full client base in 6 months. If you do, you know what, hats off to you, because you've either been very lucky or you've really worked your socks off. But it's just not realistic. I mean, I've spoken to people that have said it's taken about 5 years to get a decent client base, some more, some less. Everyone's circumstance is different, but don't take that as I'm doing something wrong or I'm not good enough, because you are probably doing just fine. And the fact that you care says that you're doing just fine because you've done everything that you possibly can. So don't feel like you need to have a full client base by 6 months or even a year, because that ain't going to happen unless you're very, very lucky.
I think everyone's journey is also different, right? So it's 100% like depends on where you live, what the client base is like, what the type of people that are there, if they're open to this already, because there are certain people in certain areas that are like more open to this type of treatment and they do this for themselves. And then there are other areas that it's not that known. So especially in the animal world. So I think that it really depends on where you are. So like, I love that advice. Just don't compare yourself to anyone and just keep doing what you're doing. If you're doing everything right, if you are treating animals and you've got a system in place and you're doing your marketing, it will happen when it happens. But yeah, be patient. So that's great advice. Okay, so my last question is for anyone that's wanting to get into this field, what advice do you have for them?
Well, I've got it all written down.
Oh,
Let me
you're
see what the
organized.
really
Love it.
answer's on. So I wanted to make sure that I actually did a little bit of pre-work on this question, because a year ago, I really, really wish that I had have had access to this information, because it would have filled me with so much confidence. So I've kind of grouped it into a couple of sections. I'll try and be as quick as possible because I appreciate we're on a time limit. So for anybody that's actually not done any qualification yet and is thinking about doing it, ignore those people that tell you, oh, but it's going to be hard work. Because yes, of course it is. It's a qualification. If you're passionate about it and you think, yeah, I want to do that, you will be just fine. But if, on the other hand, it's something that you're kind of thinking, oh, I don't really know what I want to do, and this looks like it could get me through, that sure, you might get through the course just fine. But if you don't have the grit and the determination to actually start up your business, keep going, be motivated, you're not going to get far. And lots of people I know so many clever people that really enjoyed the course. They worked so hard. They got amazing degree. They came out with like really good grades. And then they kind of just got disheartened and dropped off. And of course,
Mm.
this doesn't apply to everybody that ended up not using their qualification, because everyone's life is so different. But from my experience, I know a few people that they just didn't know what to do and thought, oh, well, now I feel like it's too late because I've been out of it for so long. So if you want to do it, you'll be fine. If you're not sure, really make sure you know what you're doing before you enroll yourself. If you're currently doing some kind of qualification and you're having the same thoughts that I did, going, this is really hard. Am I actually cut out for this? It's the same thing again. If you want to do it, you will be just fine. You will work for it and you will pass, and you will go out and you work hard and you'll get an amazing business. But again, make sure this is what you want to do, because it's not just about getting the qualification, it's about doing all of the work to start up. If you've just finished your physio course, so this is the big one, and you're thinking, oh my gosh, what do I do now? Get your promotional material sorted. So start putting up your flyers, taking out your local business cards to pet shops, dog-friendly cafes, all of that jazz. Research your local area, and that will take you far. Again, same with the vets, perhaps offer something a little bit more comprehensive than just popping in and dropping off some flyers. It is really about making a relationship and who you know, which will help you. This worked for me personally. Find a lot of local dog and horse shows, especially in the summer. They are everywhere. Fate, stuff like that. Contact them and say, how much do you want for a stall, and offer things to people. You can offer like a first discount. I tried offering 20% off to first time bookers. I would offer like a free checkup and then say, oh, if you book back in with me, here's a discount code that's valid for 6 months, etc. Offering advice, stuff like that. Even if somebody comes up to you and just wants a bit of advice, that is something, you know. And as well, I personally found that sporting shows were better, because people that do dog agility eventing, they tend to be a little bit more savvy and aware of their animal's health and realize the importance, because if their dog's lame, their horse is lame, they can't compete. If they're trying to get to Crufts, that could be the difference between getting to Crufts and not, and that's very important to them. That was my biggest success. Sponsor people as well. In the early stages, it's frustrating when you're not getting the money for the appointment because you're offering it for free, or maybe you do discount. It's up to you. Do some research. That was a massive one, because you start getting them to post for you. They start posting their success stories and giving you tags at the bottom going, thank you so much for Kelly Flude Veterinary Physiotherapy for keeping my dog fit and healthy. They start saying, my dog has been more successful. My dog's not dropping poles anymore now that she started up. That's great for you. You can also write your own educational posts as well, all that jazz. Networking is really, really important. Local dog behaviourists has been a massive one for me. So lots of behaviourists are now starting to say, you need to go and get your dog checked out for pain before you start your behaviour training. Get a good reputation, and you can start working with them to offer packages, do some behaviour assessments for them for a discounted rate, work with them. That is another massive one. Same with like massage therapists, nutritionists, even like the other people that do the same qualifications as you. It's so important to be friends with them. If they've already got a full client base, they're going to need someone to refer to, as well as all the other things that we discussed earlier. And yeah, again, the biggest one is keep your other physios and local therapists close, but don't compare yourself. It is entirely normal, no matter how well you did at uni or whatever course you did, to get imposter syndrome. That doesn't mean that you're not cut out for it. That just means that you genuinely care and you want to do well, and you're scared. And that is okay, because we're all there, You will be just fine. Just keep doing the best you can. And if you want to do it, you will. And 5 years down the line, you'll be looking back going, wow, what was I ever worried about? So that is all my advice that I can think of. And I hope that that helps and makes you feel less scared about being tossed out into the big wide world.
Oh, Kelly, thank you so much. The years, I don't even know how long I've had my podcast now, 7 years. You're the first person who has prepared for that question. So if your business runs anyway like you prepared for this podcast, I have no doubt that it is going to succeed, because the way you prepared for this, I'm sure, is the way that you handle your business too. So thank you so much for your time, and thank you so much for sharing so much, because every time we have someone who shares something and their experiences, the listeners get to learn from that and prepares them so much better for their vet rehab life.
Yeah, well, thank you so much for having me. It's been an absolute pleasure.
Have a great day. Cheers, Kelly.
And you. Bye.
If you enjoyed this podcast, please hit the subscribe button so you get notified every time I load a new podcast. I'm here every week talking to vet rehab therapists from all over the world about all things vet rehab. A big thanks to our sponsor, Curacao Vet. Their sponsorship allows us to be able to give this podcast to you for free, so please go and check them out at curacao.org. Please also don't forget to bookmark the next Vet Rehab Summit. It's on Saturday the 8th of November in 2025. Come and be a part of the world's largest online veterinary rehabilitation conference created specifically for you, the Vet Rehabber community. Online Pet Health members, you get VIP complimentary access to the Vet Rehab Summit. For more information about continuing education for vet rehabbers, you can go to onlinepethealth.com.